Running 100 miles seems impossible, and maybe even kind of crazy. And it is, but we believe in big crazy dreams. That's why we ran 100 miles. It was such a life-changing experience for us, we decided to devote this podcast to preparing and inspiring you to run your first ultra race.
Are you ready to feel the highest highs and the lowest lows? Are you ready to do what you once thought was impossible? Are you ready for your trail to 100? Thank you for joining us here on Trail to 100, the podcast made to help you finish your first 100-mile race. My name is Jacob Bateman, and joined along with me today is my beautiful and lovely wife, Melody.
Hey guys, long time no chat.
Yes, it's wonderful to have you back for a session, Mel.
It's awesome to be back. You know, life is crazy as a mom, but we're starting to get the hang of it, and I feel like I can pop on a little bit more.
Well, the podcast audience would thank you greatly because they've been bearing with me as
Jacob
I've
just bowed
flown
to me.
solo. I tell you what, everyone knows it's better when Melody's here.
Well, I like to be here. I love to be here.
So today we had a great conversation with our now friend and our go-to podiatrist in our lives now. He's earned our trust. We had Dr. Jeffrey Hammond on to talk all things feet and ankle. We talked about blisters. We talked about prevention. We talked about
calluses. We talked about Achilles tendonitis, plantar fasciitis. We talked about how to prevent all that stuff, what to do when it happens.
We basically just had an hour of a bunch of good foot conversation. Anything that happens in the ultra world with your feet. It was enlightening. I thoroughly enjoyed it. I think this one is an essential episode for first-time 100-mile runners to learn about the feet and start preparing now and learning how to take care of your feet now so that race day, can go
smoothly for you.
You don't need to be...
You don't have to learn the hard way. That's the point of this podcast.
Yes. You don't have to be walking on bloody stubs the whole way. So anyways, Dr. Jeffrey Hammond, he has a practice in Provo, Utah, where he specializes in helping athletes and ultra runners, in specific long distance athletes. He's actually going down to Pace down at Cocodona this year and help out some runners. So he's in the world. He has experience. He knows what it's like.
He's passionate about watching people succeed.
Yes, and you can hear it in how he explains things to us here on this podcast.
Passionately.
So we need to just stop talking and let him start doing the talking. So
let's go. Let's hear it.
Let's get to it. Well, thank you, Dr. Jeffrey Hammond, for joining us here on the show today. We are so excited to talk with you about feet.
I can't wait to learn about blisters.
Yes. So thanks for joining us.
For sure.
Well, anyways, so Jeff, as let's, I know I got a lot of questions coming at you. I can't even put it all straight in my head right now, but let's just start simple, okay? What is your history with running?
Yeah, so for me, I swam in high school and I hated running. I was like, I'd rather be in the water, wasn't going to do it. And then I had a friend, and I'm competitive, who's like, let's do a triathlon. And he's like, and I think I can beat you. And I was like, you can't beat me. So we get in this race, do a race, go through the swim, get on the bike, and I actually crashed on my bike, put 2 holes in my stomach, scraped up. I had blood everywhere. But I was like, I got to beat this kid. Even though I'd been down for like 30 minutes, there was no way I was going to beat him. Got up, finished the race, finished the run, did it. And from there on, I just I like that pushing through pain. Kind of like that accomplishment feeling you get from finishing something tough.
And you were pushing through actual pain, not just muscle.
Well, yeah. Well,
you were bleeding.
Yeah, and the funny thing is, the 2 holes in my stomach, I didn't even know about because I had my shirt came down. And the guy who was checking me out before I finished the race, lifted my shirt up, but pulled it forward so I couldn't actually see. And so I just assumed I was fine. until halfway through the run when the adrenaline wore off and, and it wasn't very fun. But that led to me doing more triathlons, did a half Ironman. That about killed me. I retired from the triathlon world after that. But then I started getting into, helping out with marathons. I was a race manager for the Utah Valley Marathon in Utah. Cool. Did that for a couple years.
Race manager, what does that mean?
Yeah, so I was in charge of all the aid stations. So whether it was the orange slices, the Gatorade, Powerade, all that good stuff, I set everything up. I ran the course all day, picking up runners who were injured. I was kind of the course manager for the race, which was really fun.
Awesome.
Yeah, so and it was fun to see people. I really thrive on seeing people finish something that they've been working hard to do. I mean, so like that always drove me. That really, ignited the fire to do medicine, to like really help people and see them get better. And I always liked the sports medicine aspect. I interned with a sports medicine doctor in Provo who had worked with the Olympics, some World Series teams, and it was just really fun. And what I saw that was foot and ankle stuff, right? So that led me to podiatry school. Did podiatry school, went through residency. And in residency, we're learning surgery, we're learning trauma, we're learning diabetic, a lot of stuff with the foot. And I did that for about a year after residency. I was cutting toes off. I mean, essentially is what I was doing. And like, it's not fulfilling. I mean, it is fulfilling. You're helping someone out. They're getting better. Maybe it was hard. So then, moved back to Utah, really got into fitness and running. I was working out consistently. Me and my wife did Kilimanjaro. And that really got me into that like distance, going for something challenging, right? And so long story, my trail to running, like a long 100-mile run. I started doing stuff with ultrasignup.com and Cetus, which is a running company, doing interviews with them, talking about foot health. And now I am actually going to be pacing a 250-mile runner at Cocodona this year, Shelby Harrell.
Cool.
And she's trying to break the record. And so, I went from, not liking running to the distance. And I think, man, 26 miles sounds miserable to me, but 100 miles sounds so fun. And I don't know what it is. I don't want to do 26 miles. But you say, let's go do 500 miles. I'm like, sweet, let's do it. Like, it just sounds fun.
Because 26 miles, you have to do it fast and you hurt the entire time. But when you're on 100 miles, you have moments of chill,
And I want to eat a hamburger
pain.
Halfway through the race.
That's what I'm saying.
I mean, I got my Diet Coke right here. I'm not a 26 miler. I'm a 100 miler.
Yeah, we feel that.
I love it.
That's awesome. This is going to be an amazing podcast.
So how does Shelby feel knowing she's got a podiatrist to take care of her feet at Cocodona?
This is so fun. I was actually talking to her today. We're pumped. So the first time she actually did the Cocodona, I don't know where she was in the race, but her feet were hot. So she decided to put ice in her socks. Talk about like one of the worst decisions you could possibly do. She's like, it felt great for about 15 minutes. And then her feet were soaking for the rest of the race. And she got horrible blisters, horrible swelling.
Oh, no.
And in fact, actually about a year ago, she blew out her 5th metatarsal on her foot. So we really helped her get back to running again. And so this is kind of her like revenge story, coming back. And so, we're really pumped. We're planning out every rest stop, how we're going to, navigate all the issues. She's stoked. And I think we're really going to get her there.
That's awesome.
Yeah. I need to have you come face me at Cocodona next time I go down.
Needs...
So, anyways,
let's do it.
Jacob just said it. He's doing Cocodona.
Oh, it's happening. It's on the list. It's not a matter of if; it's a matter of when. Yeah. So, speaking of that, you talked about her putting ice on her feet.
Yeah.
What are that's a mistake of What are the common mistakes that you have seen with ultra runners? Just off the top of your head that they start to do that can snowball into possibly even ending their race or ending their training cycle or whatever.
Yeah, for sure. Yeah, I mean, Very simple things. Shoe gear, not wearing the right shoe. Right there, you end the race before you even start. Whether that shoe's run over 600 miles, trail shoe goes a lot longer than a regular shoe. But if you're running in like a road shoe, I mean, you're right there. You're challenging yourself. It's the wrong size. You want to go up half size to a full size bigger in those shoes, making sure they fit well. Honestly, having good support in that shoe. And that's regardless of you're in a 0-degree shoe or a high heel to toe drop. You want some type of support in that shoe giving you the stability you need, especially when you're trail running and doing 100-milers. You're not on a nice paved road the whole time. You gotta have that stability. So that's like one thing. Shoes right there. Now socks. Don't run in cotton socks. Don't run in something that's going to make your foot sweat and get hot. You need something that's going to wick that moisture away, right? So you need something that's high wicking. There's a brand, Fasciitis. They make one with a grip band in it. I mean, I can be kind of flexible here. I got one. Woohoo! So they got grip bands in it, right?
Oh,
so you're not sliding in your shoe. So you're decreasing friction, but it's high wicking. So yeah. So you want to find that high wicking sock. So even if you do get wet and you don't have an aid station to change your sock, however, forever, it's going to wick that moisture away. Because you want to keep your feet as dry as you can, and you want to reduce friction. So if your foot's sliding back and forth on every step, you're going to get blisters, you're going to get sores, you're going to be in a world of hurt. So simple things, socks, shoes, keeping them dry, like right there, trimming your toenails. Like it's hilarious how many runners I have come in here. They have a race. Like I have 4 or 5 runners doing the Mount Charleston Marathon this weekend. And I'm like, let me trim your toenails before you go. And they're like, no, that gross feet, blah, blah, blah. I'm like, you're going to lose your toenails. Let me trim them so you don't lose your toenails.
Also, because, I'm a podiatrist. I touch feet all day. Like.
Yeah. Oh, yeah. It's hilarious. I don't think I've ever had a person say my feet aren't ugly. Or my feet, they're always like, oh, my feet are so ugly. And yeah, no one in Utah has come close to anything I've seen in other places. So, but you don't want to be out at mile 62 or 34 or whatever, and your toe starts hurting. Because then every step, all you're thinking about is my toes hurting, my toes hurting, my toes hurting, my toes hurting. And that can get depressing really fast. And, as you know, when you start getting to the end of these extreme distances, you need any mental positivity that you can have. And so the simple things, just take care of it before. Which is, those I would say are pretty straightforward things.
So the first thing you said is to find the right shoe. So I think the next question is, how do you find the right shoe?
When I first got into ultra running and, our podcast.
I think this is one of the most stressful things for beginner trail runners.
Yes. I would go into a shoe store and I literally would come out of there feeling discouraged, just straight up discouraged, because there were so many options.
You're ready to pay $150 for a pair of shoes.
And I'm like,
kind of a stressful decision.
I don't know. I'm about to dump a big chunk of dough on this pair of shoes, and how am I supposed to tell here in the store if this shoe is good or not? If my body fits it.
How many shoes in my life have I worn a couple times and and it was might
dang
as well
it, I just made a mistake.
Throw the money out. Yeah. No, choosing the right shoe is very difficult. I totally agree with you. It is not an easy thing. Couple ways to mitigate that expense. Don't go off what's popular. So someone might say, I really like this shoe. I really like this brand. It doesn't mean that brand's right for you. I think that's so easy in our world, especially with influencing and things like that. There's some big runner from a favorite place that they like that wears this shoe. That's one thing you kind of got to put the blinders on and go for, and go into a good running store to have them fitted. Don't go to Dick's Sporting Goods, okay?
Yeah.
Don't go to Owl's.
Big Five
and there's
or
nothing
something,
wrong with those stores, but they just don't have the expertise you need. So here in Utah County, there's Runner's Corner. They're excellent. They have a little track in there. They know what they're doing. They have a return policy. So you want to find somewhere where if you try a shoe and you don't like it, you can return it. Now that's a simple thing. Cool things like in my office, I have a foot scanner that will actually measure your feet and tell you what shoe brand you fit best into and certain shoes. So like for free, you can come into my office, you stand on it. It'll give you a list of shoes, say your feet fit into this brand really well. And then you can go to the store and get them. So that's something awesome. Really cool we do here. Whether you're going to get, we'll probably get into this heel to toe drop, right? There's 0 degree, 4 degree, 500 degree, whatever, whatever it may be, again, you have to know what you're comfortable with. And so don't go buy a pair of shoes and go run a race. Buy a pair of shoes, do a light run in it, and see how that is. I'm one of those people, once you find a shoe you really like, wear that shoe until they really alter the model, right? Which is annoying because they do that often. But like I love the Gel Nimbus Asics, and this year I'm like,
Asics are the best.
Like I don't like the new Gel Nimbus personally. Now someone might really love it out there, but like I used to love that shoe, and now the heel is just like a Hoka heel. Like it's just big and fat, and for me that's just too much. Which some people love. Again, not me. But yeah,
so are you a
like,
fan of like?
Is hard. I definitely trying them out, finding a place that you can return it. Half size, full size, bigger for running. For trail shoes in particular, they're going to be much more sturdy because of the trail conditions. And so trying it out on something that, you're going to have to test your ankle, your foot, you're going over rocks, giving it a good go before you do a big race or something.
That makes sense. So you also mentioned that it's a bad idea to have road shoes on the trail. And I was just talking to someone the other day who said he always wears road shoes on the trail because he feels like he's faster. So why is it bad to wear road shoes on the trail?
Take bad with a grain of salt. There's also some road shoes that would be, great. But like if you're going to go get your Alpha Flies or your carbon flying road shoes, you're gonna hate yourself. That carbon plate in there, whatever it may be, is gonna just wreck you. That being said, now if you go into that like mainstream training shoe, it's not bad. You got to look at your conditions. If you're gonna go run on a dry dirt trail that's pretty level and everything, great, that's fine. But if you're going to start going over rocks, you're going to be climbing rocks, you're going to be gaining elevation, there's loose gravel, you're coming down on loose gravel or dirt, that's where a road shoe is going to be much more slippery. And so that's going to cause you to use your ankles, your muscles, all those muscles more than you want to, and you're going to wear out quicker. But if it's like a trail where you're just like, it's a dirt trail through beautiful meadows and stuff, like, road shoes totally fine. And honestly, I understand the I'm faster feeling because they're lighter, and he might be truly faster in those shoes, but put him in some really rough terrain, he won't be as fast.
Yeah,
because he'll be slipping on his butt going down the rocks.
He's gonna be beat up.
I know personally, when I run on the road, I like a squishier shoe, and when I'm on the trails, I like to be able to feel the rocks and the roots a little bit better, so I like the more zero drop, more minimalist style on the trails.
Me too. I like a sturdy sole, but I like something that's not big and thick. I personally like a more minimal cushion.
Well, and I was gonna say, if I run on the trails with road shoes, which I've done before, with like my squishy road shoes, I feel like I'm more likely to sprain an ankle. Like I feel like I need to feel the ground a little bit better than when you're just on a road.
You hit it on the mark. Like if I go run on the road, man, I want the big fat cushion. Like I like the Gel Nimbus then. Like I'm great. Like things are good. But if I'm going to go run anywhere where I have a little bit of this, you're so high up, and it's not necessarily like a heel to toe drop. They just have so much cushion that you're not stable,
Yeah, that makes sense.
And you don't want to roll your ankle. That's the worst.
Oh, it is the worst. Because then if you roll it once, then you roll it on every run forever for the rest of your life. That's what it feels like.
Well, come see me and I'll help.
Okay.
There we go. Have you heard of the book Born to Run?
Of course, he's a podiatrist. Of course he's heard about that.
I just
that's all right. Go for it. Yeah, no. Born to Run. We're diving deep here.
Yeah, so it's the Tarahumara, right? The tribe down in Mexico. They run and basically they slap a tire sole and turn it into a sandal.
Yeah.
And here they run 100 milers. And
I feel like this is where things can start to get controversial.
I guess
I'm excited.
And and in that book, this guy ends up swearing at the end, that he had all these injuries and he started running the barefoot way.
Running was the solution.
And he can now run for hundreds of miles.
Yeah.
What do you think about like things like that? Because I know in today's world, like we're talking about these giant cushy shoes, and Hokas and the carbon
and you even
fiber.
said that's the most important thing. Get
shoes,
a good pair of shoes.
Yeah. So like, what do you think about like people who are thinking like they battled injuries and they think maybe the barefoot way or the minimalist way is for me? What's your thoughts on that?
Yeah.
Between the contrast there, I guess.
Yeah, let's dive in deep. So
yes,
barefoot, nothing on your foot. Please don't ever do. Okay, just if you're gonna go play at the park, great, but don't go run 100 miles barefoot. We'll just get out of there. That's barefoot. Okay.
Well, I mean, the Tarahumara don't even do that. They
you gotta have
throw
something.
A tire out there.
Yeah, they got something. And that's funny because people are like, "Oh, born to run, they run barefoot," and I'm like,
"Yeah,
no,
not necessarily."
There's so much stuff out there, so many other issues. Don't do that. So that's a simple thing. But the whole idea of like a 0 degree or barefoot running, I don't have a problem with it. However, that being said, you have your cute little kid. You put them in a cute little pair of shoes. Naturally, that shoe already has a heel to toe drop in it, okay? And then that kid, grows, you give him a cute pair of Nikes because you like it, it's got a heel to toe in it. So naturally, your Achilles, which, attaches to your heel bone and comes up to the back of your leg, shortens because it's used to being in some type of lifted shoe.
Basically, our society is messed up. And
It's just
and we need to just
right?
put tires on our kids' feet.
Put tires on your kids' feet. Well, honestly, your kid until like 6 years old should be in a really flexible shoe. They shouldn't be in anything too rigid. Now, after that, they should go into a more rigid sole. But that still being said, 0 degree heel drop doesn't really matter. But if they are consistently in a high heel to toe drop or something, their Achilles is naturally going to be shorter. Not like that it can't get longer, but lengthening it's going to stress it out, right? So if you're someone out there who's like, hey, I had lots of injuries, all this, I want to try this barefoot style of running out, great. However, that being said, the first day, go run 100 feet barefoot or in a 0 degree shoe. And then the next day, run 100 feet. Then a week later, start building it up. Because that Achilles, even if you only lengthen it 2 millimeters, Achilles tendonitis is going to jump in, plantar fasciitis is going to jump in, and you can actually cause more injuries. Now, some people are already used to having a 0 degree. Maybe they're just one of those people that have always worn like a flat pair of Vans or whatever it may be their whole life. Them going into a 0 degree or barefoot, they're going to be fine going out for that run. So there's nothing wrong getting to that. It's just making sure you're going that direction. Again, but someone running with a high heel to toe drop, they're not like a worse person. It's not like all of a sudden they're going to lose that race because they're not wearing that new style shoe, right? Like that's not how it is. So the guy who, his injuries went away, like maybe that's true. Maybe he strengthened those muscles differently and that helps. I don't think your foot's intrinsically going to get stronger by going to a 0 degree. I do think when I say like a support, now this is controversial here and I'll caveat here, but like an orthotic, right? Now we can get into that in a second, but that support.
Jacob bought some orthotics.
Yeah. Orthotics, that is, a conversation there, but supporting that foot is important. I always explain it like if you were to tell someone to curl 50 pounds, but you extend their arms completely out, right? They're fully extended. They're going to have a really hard time curling those weights. Their muscles are past the point of their optimal position. You have them just bend their elbows slightly, they're going to be able to curl those weights much easier. Same thing with the foot. You can have a 0 degree where the heel and toe are on the same level, but that arch, if you're flattening it out, you're then taking those muscles up your legs and putting them into a suboptimal position. And so they can't strengthen. They're going to weaken out quicker. And so if you can get some type of support in that shoe or whatever you're wearing, you're going to go longer. You're going to prevent injuries. You're not going to fatigue as well. And you're going to get stronger. But that's something outside of that barefoot 0 degree. But yeah, so barefoot running, I mean, go for it. If you're doing it, awesome. If you're going to do it, just work up to it. It's not, maybe it'll help that person not have injuries, but I don't think it's the cure all.
Yeah.
I don't think Born to Run is the Bible of running.
Right.
Okay.
Right.
I agree. I agree with you.
So what do you think of, one thing he talks about is when you run barefoot, it helps your running form. Because you can, feel the ground better. And I've played around with that.
Yep.
And it totally makes sense because when you're in a shoe, you don't have the same
feeling,
like proprioception. And then when you take your shoes off, I've noticed that my stride shortens and it just feels better on my body. And so I've practiced before, running barefoot, filling that form and then putting my shoes back on and then trying to kind of maintain that form. What are your thoughts on that?
Yeah, I mean, I think with any sport, there's really good ways of training, right? And I think going barefoot to see that form, to really feel how you're hitting, how you're rolling, and I'm not a form runner, I'm sure I have horrible form running, but that's me. Like, I'm not here to coach you on like, what's the best running technique. However, that being said, going where you can feel it, like you said, that proprioception, that feeling, if you're trying to alter or change your running to make, whether it's increasing the speed or whatever, doing that barefoot and learning is great. But when it comes to the long term, you're going to want that shoe there to protect your foot and give you that support. And again, like we said, there's fat cushions, there's thin cushions. You can still get a very proprioceptive shoe that's got a thinner cushion to allow you to feel that and let that running go. I mean, if you look at spikes on runners, I mean, it's spikes and basically nothing else, right? They're basically barefoot running. So, there's nothing wrong with that. And I like what you're saying. Training like that's great,
Awesome. Okay, so speaking of squishier shoes and more minimalist shoes, I want to know your thoughts on the big squishy shoes because that is the popular thing right now.
Yeah.
Even brands, like Ultra and Topo that started out like less squishy, they're getting squishier. What are your thoughts there?
Yeah, the new Ultra, what's it called? Their kind of mainstream one it's got a cushion. In fact, someone sent me a picture of one today and I was like, wow, that's impressive. And I think
it's Hoka level.
Yeah.
What?
They're on Hoka level now.
Everyone's trying to be Hoka.
They are. Well, and and to their like defense, they want to sell shoes, right?
Yeah.
And so people are going for that cushion. I was surprised. Someone texted me, he's like, this has a 4-degree drop. I'm like, Ultra has a 4-degree drop? Like, what's happening? Like, that blew my mind, right? I was like, what in the world? And I started running in Topo, some of them sometimes, and I really like it. So anyways,
Topos
outside
awesome.
of that, but back to the cushion thing. I'm not against a cushion. Okay. If you want to run in a cushion, awesome. I do think personally, if they don't do the cushion right in the hill, it leads to higher ankle injuries. I can't say that definitively. I haven't done a study, I haven't looked at 100 runners, blah, 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 blah. That being said, I definitely feel it. Now, the reason why people like it is they have heel pain, right? And so they're like, I got this cushion. It feels great. Great. Honestly, it's because they have more support in their shoe. They could get rid of all that cushion. If they had better support in their shoe, their heel pain would go away. That's my opinion. I don't think you actually need 2 inches, 3 inches of foam to be comfort. I saw it's On. They have like this foam one, and like they were showing it on their Instagram, and I was like, it looked like marshmallows. And I was like, people are gonna roll their ankle all day on that thing. Like,
that's what happens. I've seen so many people roll their ankles in these big squishy shoes.
And especially if looking in the trail world, you're running up in the mountains like behind me here. You're gonna roll your ankle hopping on those rocks. Like it's not. I don't particularly enjoy it. And that's my personal opinion. There's going to be someone out there who's going to write in or say, this doctor's a quack, get him out of here. But yeah, that being said, there are shoe brands that I totally don't like, but that's more of a personal thing. Some people really like them. There are some that I don't feel like anyone really likes, but they're popular. You know, like there's those out there. But yeah, the cushion, if you like the cushion, you do well in the cushion, great. I think if it comes to trail running, I'm one who feels like you're going to do better feeling where you're going. And that proprioception, especially ankle sprains and stuff, when you build that strength up by feeling that proprioception, you're going to be a stronger runner and you're going to last a lot longer too.
Yeah. That makes sense.
Like I'm all about like the barefoot, get a Bosu ball, stand on a Bosu ball, curl weights on the Bosu ball, put one leg on the Bosu ball, curl weights, anything to create that instability is going to strengthen those ankles and get you really going.
So,
that's awesome.
Speaking of that, I wanted to ask you, like, you mentioned the Bosu ball exercise. What kind of exercises would you recommend in general for preventing foot and ankle injuries for ultra runners?
Yeah. Yoga. Get into yoga.
Yoga.
I said yoga's the best, but it's also the worst. I just have to throw this in really fast. I've struggled with Achilles tendonitis for 5 years because I wore high heels my entire life, and then I decided to run in ultras. Yeah. So super dumb, but I didn't know at the time.
Yeah, that's
I thought it was going to make me
Achilles thing, right?
Yeah. But anyways, had a baby, took time off of running, and got into yoga, doing yoga every single day. Achilles tendonitis is gone, and now I'm running again. No Achilles tendonitis. Anyways, so
yoga,
super awesome.
I mean, now my experience with yoga is I went in, the instructor came over and helped me, and I was like, this is my first time doing yoga. And she's like, I can tell. That was also my last time doing yoga. I'm like too embarrassed to go back to a yoga. So if someone out there is a really nice yoga instructor, look me up. I would love to come do more yoga. That being said, so I think yoga is a great one because going up onto one leg, anything like that. Pilates is a great one. And then for us, maybe more manly men, if that's appropriate, like that don't want to do yoga or Pilates. Bosu ball, instability exercises, balancing boards, anything like that's really, anything that tests those ankle ligaments is going to be great. TRX bands, things like that where you're putting yourself at a disadvantage appropriately will really help you out a lot.
That makes sense. And I have to throw this in for the manly men out there who don't want to do the fluffy yoga. There was this guy on YouTube.
Harder than anything.
It's so hard. It is.
Yeah.
There's this guy on YouTube named Sean Veig who does yoga for athletes. I don't know if you've ever heard of him, but
I'm gonna look him up,
he does yoga like for men, and he just like cracks jokes the entire time, takes all the fluffiness out of it. Yeah. And it's so fun. I like laugh through all these videos. But anyways.
Like fluffiness. I kind of have a soft side.
The fluffiness is good. It's good to tap into the soft side.
What I really want to do, I want to do like that 110-degree yoga or 120-degree yoga. Like that sounds fun to me.
Yeah.
Like, again, I'm weird. And that's why I think I like ultra so much is because you're pushing yourself into that weird zone, you know?
You know, it's true. We're talking to ultra runners here. I feel like we're all kind of hippie, right?
Yeah.
Anyways.
Well, and when I started doing triathlons, that's what the vibe was. And now it's become such a mainstream thing. Like marathons, triathlons are kind of, and nothing against people who do that. I work with them, love them, but it's become such like an industry, right? Like I had a $1,200 bike, and that was like high end back in the day. And now that's like, you have to spend $15,000 to get the high end bike. And nothing wrong with that, right? But I feel like with trail running, it's like throwing up a good pair of shoes, go run around that mountain. Let's go grab cheeseburger and a milkshake or whatever. And
the perfect day.
Yeah.
Just
like that just sounds
amazing.
Like, so when I did my half Ironman, all I wanted the whole time was a bacon cheeseburger. Yeah. And I couldn't feel like I could tell people that. It's like, no, you want your goos, your bananas, your
quinoa fruit salad.
Yeah, quinoa. Yeah, quinoa, right? Like, yeah. Don't you dare eat a Snickers. And like, that's what I want to eat. And I think one thing that really changed my perception was, so they used to do a race here in Utah called the Tour of Utah. It was a bike race. And I think it was like, 8 days maybe. But one of them was doing that. One of the legs went through the Alpine Loop behind Timpanogos. And I was up there, and these French and Italian guys are coming by, and we're cheering them on, and they're laughing. And then they started chugging Coke. I mean, they were just drinking Coca-Cola like left and right. And I was like, what are they doing? And then, we talked to them then, they're like, that is how you get sugar in you. You get it. That it's such a great way. And I'm like, that's a healthy way to look at life. Like, if you can drink a Coke in the middle of something, you're doing it right.
Yeah, it's all about balance, right?
I love it. All right.
That's funny.
So we hit a little bit on injury prevention.
Yeah.
What about you start, for the runners out there, they start feeling something in their foot and their ankle.
Yes.
A pain starts creeping up when they run. I know a lot of runners just
Burn the running shoes, stop running, don't ever run again.
Yeah. Like it's so hard to figure out, like, when do I go in to a doctor such as yourself to figure this out, or when do I just, this is just a normal niggle. If I just keep running through, it will work itself out. Do I push harder? Do I stick with my training plan? Do I draw back, for a few weeks? Is that going to screw everything up? Anyways, when they start to feel something, I guess, what do you have any like standards that you would maybe advise them, like ask yourself these questions to decide what to do? Yeah,
that's a great question. And I'll give my answer. And now, caveat out there, it's different for everyone. Depends on the pain and everything you're having. But it's one of those things where, like, let's say you go out for a run, you've been training for some big race, you come back and the outside of your legs are hurting, the bottom of your foot's hurting, you ice it, you take ibuprofen, kind of goes away. The next day you run and you're like, you feel it again, but it kind of goes away. That's something where I'm like, okay, push through it, see what's going on. Maybe you're building up, you're getting sore and everything. But let's say, you go out for a run, mile 7, man, that hurts. That really hurts. And you push through it. The next day you go for a run, mile 7. Wow, that really hurts. That really hurts. Next day, mile 7. And that kind of consistent mile mark, right? You hit a certain place and that same pain comes. That's more telling of something more injury prone, right? It's not a soreness. It's not like at the end of the day, man, I'm just really sore. It feels worse than normal. And that might be just we're building muscle, where we had maybe a slight tendonitis. We ice it, it goes away. If you start doing something and you're running for a week, 2 weeks, and that injury either stays the same or gets worse, it's time to go see someone. If you're running, it's maintaining, kind of goes away, comes back. You're able to do what you're doing. You're maintaining the pace you want to hold. You're increasing mileage and you're doing all right. You're probably, I don't want to say all right, but you're probably going to make it through what you're doing. Now, if you go do your big race and you're still having those issues long term, then get it checked out. But it's more of those like acute injuries where, like, man, or I ran the next morning, I go for my run, it still hurts. Those things that just won't go away, you should get checked out sooner. But yeah, it's a difficult thing. There are a lot of things you can push through. I'm all about pushing through things. I'm one of those people, if you come and see me as a physician, I'm going to say, okay, let's keep you doing what you're doing. How can we augment what you're doing to keep you doing what you're doing? Like, I have someone with a calcaneal fracture right now as a runner. And I'm like, okay, let's bike, let's swim. Like, we're going to keep you active. So when you come back in 6 weeks, you're not like rolling around, don't know what you're doing, right? And so I think there's a lot of things we can modify too, because you build up to 18 miles and 20 miles, 50 miles, and then all of a sudden you got this big race and you get injured. Well, let's keep you still going that right direction so you're ready to do your race and you don't have to pull out. I always think if you're going to lose sleep on it, go get it checked out. That's just the easiest thing. Yeah. I mean, for me personally, so I'm a direct care provider. I don't do insurance. It's a simple fee. Awesome. You come in, you get 45 minutes with me. Come talk to me for 45 minutes and let's ease your anxieties and get you back to what you're doing. I think that's a great way. I think finding the right doctor for you, a lot of doctors, is that 5-minute, that's what's wrong with you and leave. That's not going to give you that satisfaction. Find someone who's really going to work with you. That's unique with how I run my practice. I don't try to see 30 patients a day. I personally want to see 7 to 10 patients. I have other things that are going on, but I like to talk to people. So yeah, I always think if you're going to lose sleep on it, get it checked out. If you're doing all right, you're maintaining your mileage, you're able to do your pace, whatever it may be, you're probably all right.
What are your thoughts on trying to figure it out yourself? Like going to YouTube and like, oh, here's
Google.
some exercises for Achilles tendonitis. Maybe I'll try this for a little bit, and then if that doesn't work, then I'll go see someone.
fasciitis.
Yeah.
Oh, I think I got plantar.
Yeah.
Let me Google it.
Yeah.
I mean, Dr. Google Gemini is pretty awesome out there. They do a good job. No, we all try to do that, right? Like,
Right.
how many house repairs have I done where I watched someone on YouTube, solve the issue? I'm not against, I think information's key. I don't have a problem with people looking up the information. I think the hard part is making sure you're looking at good information, because it's
Right.
really easy to find bad information. So whatever you're looking at, look at the sources that information is coming from. Is this coming from, Jim in his ranch or lean-to in the middle of nowhere who's just creating content? Or is it coming from physical therapist? Is it coming from a doctor? Is it coming from someone who has the knowledge behind it? I think that's good. I think you get like influencers say, I had this injury, this is what I did. Well, that doesn't mean they truly had the knowledge for you. So I think it's not wrong to look something up. Plantar fasciitis, Achilles tendonitis, it's good to know. And there are things they'll say like ISIT, ibuprofen. No, follow the basic things. Now if they start saying, hey, get this ointment or start get this injection offline or whatever, you can't really do that.
Red
But
flag,
they
red
tell you to
flag,
do
yeah.
something kind of outside the norm. That's when I'd say, okay, it's time to maybe go get it checked out. But I'm all about looking it up. I do it.
Right. Who doesn't?
It's
Who
fine to
doesn't,
do.
right?
Yeah.
Yeah. Okay.
Yeah. Go for it. Knowledge is power. Again,
Amen.
just don't do anything crazy. Just like
Don't listen to the influencer that's like hang
Yeah,
upside down by a rope and then, I don't know,
Yeah,
light a fire.
I had this guy come in. He had this foot insert in his shoe, and had like marbles on it and things, and it was supposed to like do like reflexology kind of zoning thing, and like I'm not against non-traditional medicine or anything, but like kind of think it through. There might be something better, right?
Yeah. That makes sense.
Don't do a hot cold walk to get ready for your race.
Do a hot cool walk to be cool, but not to get ready for your race.
Cool. Like if you're gonna do it, invite me and I'll come watch, and then I'll help you after.
Okay. So you mentioned, and we mentioned plantar fasciitis a little bit. I that's something that I hear a lot with ultra runners, like, oh, I'm battling plantar right now, or it comes and goes. What even is plantar fasciitis?
Yeah, plantar fasciitis. That is a great question. So think of your foot, right? I'm going to use my arm here. So
Pretend
kind of
your arm is a foot.
Yeah.
This is my arm's foot, right? Here's the toes. Here's the leg. Blah blah blah. So plantar fasciitis is like that pain, right? You get at the heel of your foot, right? Like right on that hill and everything. I got some kids trying to break into my office.
Oh, jeez.
So you get some, that heel pain. You wake up in the morning and it just hurts. And then you kind of walk around, it kind of goes away. You get active, it hurts again. You sit down, it hurts again. So what it is there's these ligament or this band of fascia on the bottom of your foot. And it kind of builds your arch, okay? So it's kind of building that arch up to you, supporting that arch. What happens is you're getting micro tears at that spot. But the reason you're getting micro tears is actually because of your Achilles. Okay, so your Achilles gets tight. When your Achilles gets tight, it pulls up and it flattens your arch. Now, when that flattens, it flattens that band of fascia and you start getting those micro tears. So usually, I would say 90% of plantar fasciitis is because the Achilles is tight and it needs to be stretched out. So if you're starting to get plantar fasciitis, you really need to stretch that Achilles out. That is key. and then getting some type of support for your shoe or every day where you're maintaining that arch, because every time it flattens, you're just irritating those micro tears. If you can support it, it's no longer going to flatten itself out. So stretching the Achilles out, things like that. And that's where like people who are going into that 0 degree from where they haven't been in 0 degree, they get that plantar fasciitis. People who are on their feet all day, they just get tight, and then it just rolls into that plantar fasciitis. So stretching is really key there. But yeah, so plantar fasciitis, simply micro tears at the plantar fascia, that band the fascia, because of a tight of Achilles and lack of arch support.
Okay.
Yeah.
That makes sense.
So like, if a runner's dealing with that, would one thing they could possibly do, because the Achilles is going tight, is maybe getting a higher heel to toe drop?
Yeah, I mean, I don't want to like say like go directly into a lift.
Okay.
I think that would be like a short-term fix, right?
Okay.
I think it's more stretch that Achilles, because
Okay.
stretching your Achilles is going to get to a point where you can be in whatever you are. Now, let's say you went from like a high heel to toe, you went to a 0 degree, and you got plantar fasciitis. Maybe go back up and then slowly work your way back down if you really want to go to a 0 degree. I think, because I'm not against a 0 degree doing it, but if you do that quick thing, that could be there. I would say stretch. I would say ice, ibuprofen. But if it's not getting better over a couple weeks or whatever, that's when it's time to go see someone, just if there's some other alternative ways to get you back quicker.
Okay.
So what are your recommendations for how to stretch your Achilles?
Yeah, great question. Well, feel free to come in here. I got a really cool guide that tells you everything.
We're gonna come in.
Yes.
Expect to see it.
Please do. Like, you guys can come get a free medical pedicure. Come check out the office.
Oh, heck
Heck yeah!
My office.
I just
is
heard the
very
word
different.
pedicure. I'm in. Yeah.
Yeah, it's a fun place. Yeah, and we'll do all this fun stuff. Okay, now I forgot your question.
Oh, sorry.
That was a
How
really good
to
question.
stretch the Achilles?
Yes, stretching the Achilles. Yes. So, there's 3 main stretches that I really like with Achilles. Okay. So one is those stretchy bands or a towel, throwing it around your toe, pulling your toe back, right, bringing it up where you're stretching the Achilles. That, and now the key is you have to hold it for like 30 seconds to a minute. Like, don't just hold it for that 10, 15 seconds. You really need to hold it for a long period of time, because the muscles, sodium channels in the muscles, after about 24 seconds actually relax more, and so you can get a deeper stretch. So that's one. Putting your foot up against a wall or hanging off a step where you're bringing those toes up, that's a really good one as well. The other one I like is you put your hands like on a counter height, and you kind of got your legs back and you're stretching that leg. That's really going to help too. So I always tell people breakfast, lunch, dinner, brushing your teeth. Both sides, even if it's only one side, stretch both sides. Do each of those 3 for a good, 45 seconds, and make it part of your routine. And you'll be surprised, especially if you're someone who's just barely coming on. Like, I'm always fluctuating between barely coming on plantar fasciitis and not. And I start doing the stretches and it goes away. Other things you can do, this is all free advice: buy a water bottle, freeze it, roll your foot on it. Over-the-counter inserts, be wary of that, because they're not all created equal, so just come see me. But like, if you're like one of those people that wears like the like Old Navy $5 flip-flops, like that's going to be horrible on your plantar fasciitis. Wear some supportive shoes. If you're a barefoot person and you're dealing with plantar fasciitis, get a pair of shoes you can wear inside the house. If you're a barefoot house, something that's clean. Just always be in it for a good while to see if you can kick it and get it back to normal, and then you can go back to your regular routine.
I wore Chacos in the house for a few weeks when my Achilles tendonitis got really bad, and that helped a ton. Yeah, it was awesome. Yeah.
Well, and Chaco is a great, I mean, if you're looking at sandals out there, that's a great, Chaco's a great one. It's got a great arch in it. It's going to give you that support you need. Now, don't everyone run out and go buy Chacos. You got to, like, they don't fit my feet. I put my foot in it, and it's like, who did they make these for? I don't know. My foot looks weird in them. But yeah, Chaco, Tiva, Birkenstock.
Are you saying my feet are weird?
No, my feet are weird. My feet are weird ones. No, it was funny. Like I was like, I'm gonna try these, and like maybe and of course they were the discounted ones, so maybe there's something wrong with the shoe. I'll be honest. I didn't want to go buy. They're expensive, but they're great. Tacos are great. Tevas, Birkenstocks again. I really like stuff like that. I think one thing to think about, and the reason a Chaco Nativa is really good, is they have a heel strap, right? They're wrapping around your whole foot. So when you're walking, you're not clawing your toes. And because that can lead to hammer toes and things way down the road. So it is good to have that heel strap if possible.
That makes sense. Hear that, guys? Throw away your $5 Old Navy flip-flops.
Yeah.
Throw them away.
Please.
Is it, so UFOs, are they, you like those? Whatever, do you?
I
don't have a pair, so I'm not going to give a definitive answer.
Live for our UFOs.
If you want to give me a pair to try out, I will definitely take them. I think the hard part for me is I am like a Birkenstock man. Like,
heck yeah.
I just love Birkenstocks.
Okay, gotcha.
So, but no, UFOs, people love them. I've never worn them. Don't have a strong opinion yet.
Oh, yeah. Well, they feel great after a run. I tell you what, slapping those things
after a
on.
run, recovery, awesome. Yeah.
All right. So moving on, blisters.
Okay. Yes.
I'm going to start the same way. Okay. What is a blister? Give us the scientific explanation of what a blister is.
A fluid-filled skin sac. I don't know. That's not scientific.
Okay.
Yeah. So the best way to explain it's like, I know this is a podcast, but you got my hands here. You got layers of skin, right? Your skin has multiple layers, okay? Especially on the foot, it's just thicker. You have a thicker layers of skin, and what happens is you get friction, okay? So it's basically a friction rub. It's like, a rug burn back in the day. You're rubbing that spot, and what's happening is you're loosening those layers up, and fluid gets in between it. Because it's getting inflamed, the body's sending, more blood to the area, whatever it may be. It starts becoming a fluid-filled sac. So you now have a separation of skin with fluid in between two layers of skin or multiple layers of skin. Mm-hmm. And so that's where it starts. So if you have a blister, that means something's going on in what other shoe or activity you're doing that you need to look at. So if you got a blister on something, there's something wrong. It's like if you get a brand new pair of Birkenstocks, you're probably going to get a blister because they're just like kind of hard on that foot. But they're going to break in. So like you have to understand, like maybe that's going to go away, maybe it's not going to go away. But if it's a pair of shoes you've always had and you're now getting a blister, there's something wrong going on. If you're getting blisters on the tip of your toes, there's something going wrong. There's some type of force or friction causing that blister. They don't just randomly appear. There's something that's caused them. Now, this is a running show, so there's some type of friction. There's chemicals and things that can cause it too. But typically it's a friction causation.
Okay.
Yeah.
Okay, so blister comes. Well, let's say you're starting to feel something and you check your foot and it's a little bit red.
Yes.
So that would be a hot spot.
That'd be a hot spot. Yep.
Okay. What's the correct way to approach it once you have a hot spot?
Amputation. Just pull it off.
Just get rid of it.
I think a lot of runners would like to do that.
Yeah, that's always my
in the midst
my
of the race.
Just cut it off. Just get rid of it. No, yeah. So if you're getting a hot spot now, where are we talking? Are we talking about we're training or we're in the middle of a race? Because that really also.
How about both? So what would you do in training?
You're starting to get a hot spot. I would try some type of protection. The next time you go out. So if you're out running, you're getting a hot spot, I would stop that training. Hitchhike home, walk home, roll home, crawl home. No, just like take it easy, right? You don't want to get a blister all of a sudden. Figure out, was my sock bunched up? Did my shoe fell? Did I get a rock in my shoe? What might have been that causation of that blister? And then I would say, get some type of padding over that spot. Now, moleskin's always thrown out there, right? That's kind of your cheap go-to one. particularly I sell a silicone pad that you can stick in a lot of places. I have like a friction gel that gets rid of friction. So those are things you can try. Now, let's say you try those and you go out and you're still having that hot spot sensation or pain. There's something more going on. Time to try a new pair of shoes. Try some type of insert or something to give you more protection, whatever that may be.
Maybe a new sock.
And honestly, and how much moisture? Moisture is key. If you have sweaty feet, you got to solve that problem, whether it's over the counter antiperspirant for the feet or a prescription based. I mean, TMI here, I have sweaty armpits. I use a prescription, helps great. You can do the same thing for your feet, your palms, whatever it may be.
That's good to know. I didn't know that was an option. Is it? Yeah. Is there like some kind of spray you could like spray it on your feet and make your feet
in
not
my
sweat?
office, I have 2 particular ones that you can roll on or spray on. There's prescription strengths ones that are amazing, and honestly, you put them on, you're golden. Like
it's just like an anti-perspirant, like
essentially,
deodorant,
yeah.
right?
But it's a little different. I mean, you can't just go buy your Dove Men's or Gentle Care. Or,
can you just rub deodorant on your feet?
Yeah, just go get some Axe and just like go to town like you were in middle school or whatever it may be.
At least you wouldn't have stinky feet.
Yeah, you would not have stinky feet. But yeah, no. So that's one thing to look at is, are you putting a lot of fluid? Is there moisture? So yeah, good socks, things like that. Are your shoes wet? Are you changing your shoes out? I mean, people who are listening to this and you're going to go run 100 miles, you can't just buy one pair of shoes. Mm-mm. And you got to have multiple pairs of shoes. Like,
be prepared to tell your wife you need more than one pair. Yeah,
or your husband or whoever, your partner, whoever it may be. Your dog, your cat, tell them, sorry, you're not going to get kibble for a while. I got to get some shoes, right?
No more wet dog food.
No more wet dog food.
Just
no more
dry stuff
fresh caught Alaskan halibut salmon mix. You got to get the jerky. No, you have to invest, and that's really key. So that's your training, right? You're in a race. You're 30 miles in, you're 50 miles in. Next aid station, change your socks. Have someone there who has moleskin or something that you can put on it. Even if it's just a Band-Aid, do what you can. Try to dry those feet as best you can. Now, if you're towards the finish line, I mean, honestly, just go for it.
Yeah.
It is what it is. You go for it. You cry. You come see me on Monday. I take care of it. I massage your feet. Life's good. One other thing is, let's say you're running and you get a big blister and you come into an aid station, you take off your shoe and you got this $50 size blister full of fluid. Typically, if this wasn't a race, I'd say wait a day or so and then drain it. In the race, I say drain it and go for it. I mean, and when I say drain it, you poke a little hole in it, you drain it, and you leave the skin. The skin is acting like a Band-Aid and a barrier. If you're training, give it a couple days to see what happens and then do it. But in a race, I would say go for it and drain it.
Would you say drain it and then maybe cover it afterwards?
If you have the ability to, yes.
What are your thoughts on KT tape for covering blisters? Because that's what I use. I just always keep a roll of KT tape in my bag. The only thing I've noticed is, and again, maybe this is TMI, but it's not. We're all ultra runners. This is just the facts of life of ultra running anyways. But when I take the KT tape off, sometimes it rips the blister or it will pop the blister.
Yeah, so the problem with KT tape, and that's exactly, you hit it on the head. It's very sticky. It's maybe aggressively sticky. Whereas
it doesn't fall off, which is nice.
It doesn't fall off, which is great. And if you're in the middle of a race and that's what you got, great. I would say that's where you start looking at other avenues of like, whether it be like a moleskin. The stuff I have here is amazing. You can stick it right on. But pulling it off is the risk of pulling that skin off and having a really raw sore. But if you finish your race and you're in comfort, tape the heck out of it. Go for it. Athletic tape, whatever it may be. I mean, just know you're going to pay for it later.
That makes sense.
But you're going to heal. They're your feet. You know,
there's no crazy like precautions, like risk of crazy infections or anything.
Yeah, I mean,
that.
I wouldn't put it on and then leave it on for like 5 days.
Yeah,
I would definitely take it off. You got to clean the area, make sure it's really good. Especially if you rip off that skin, you want to make sure that's really protected, and keep it clean. Now, it's coming in the mail, but I got from Europe a friction gel that's supposed to be the high-end best thing ever. So stay tuned on that. That is something. Rub your feet in it, put your socks on, and you're golden. Apparently, it's
that sounds
never
amazing.
seen before.
Yeah.
In customs.
Yeah. That alone's gonna bring me down to your office. So.
Yeah. Come down, come hang out here, get your foot scanned, and then look at all the cool stuff.
Yeah.
Sweet.
Cool.
That sounds awesome.
Now this question's just I guess a little bit of a selfish question, but
I like selfish questions.
I mean, I think a lot of runners might.
We really just do this podcast so we can learn.
Yeah. I want to make you guys faster, you know?
Right.
So I noticed my first, when I first couple years in ultra running, getting blisters was a pretty regular thing.
Yeah.
And then one day, it just like disappeared, and I don't get blisters. Is it because my foot calloused over? Is it because I found the right shoes? Is it the combo of it? Like, is that common? Like, when you start upping your mileage for the first time, then that's when you're really gonna have the most, and then your feet start to figure it out and learn they don't have to blister all the time. I guess what is there something behind that of my experience that I had?
I mean, did you drink a special Gatorade? I mean, no. What it really comes down to is blisters form because, of some type of causation, trauma, repetitive trauma. Calluses, the same thing. There's some repetitive trauma that's building up that callus. Your body's really smart, okay? Your body understands what's going on. If it's understanding you're consistently hitting a certain spot, but it's not like a true traumatic spot. It's just a new experience. Initially, you're going to get those blisters, right? It's just a new experience for the body. But if it's not really a true trauma like spot where your body's like angry, your body will adjust. You might actually have formed a slight callus. I mean, it's like weightlifting, right? Like I had calluses on my hands from where I grabbed dumbbells and all that. And like they blister initially, and then you get a little callus. And a little callus is fine. Your skin thickens. It will naturally thicken up, not even necessarily be a callus. You might have gotten the right shoes. You might have chosen the right sock that day. Whatever it may be, there are some things that might have changed. You might have gotten more proficient in your running in a better form. So I think there's a lot of things that can really run into what's going on. I would say if it's a blister that you're continually getting after months and months of training, there's something wrong going on. If it's a blister that then turns into a thick callus, there's something wrong going on. There's something that needs to be changed. But if it's something where you get that blister, it goes away, you get that blister, it goes away, it might just be adjusting to that new shoe, it might be adjusting to that new insert, it might be adjusting to the new mileage. Whatever it may be, that's where you got to kind of like, don't rush. You don't need to rush and see me. Now I'm happy. You can come in and see me. We can talk about it. But that's where you got to kind of like think, what's going on here? But I think there's multiple answers to that. But honestly, your body will adjust to that new mileage. Just like your legs build up, your muscles build up, your body's going to build up and understand that constant friction is a new me. Yeah. Like I need to build up.
I guess I need to accept this.
Yeah, I need to accept this torture.
If this is what Jacob's going to do to me from now on.
Yeah. Well, and like a good example is like elevation, right? Like someone going from sea level coming to Utah and they go for a run, they're gonna suffer, right? Like it's not going to be easy for them. Just like if I was on top of Kilimanjaro, I thought I was fine. I did a little hop skip to go take a photo, and I was like, dying. Yeah. Your body just doesn't. It needs to adjust. Now, if I stayed up there for a couple of days, I could go run a mile and have no problems. Like, it's just that adjustment period.
So, speaking of calluses, should you ever shave down your calluses?
That is an awesome question. Yes.
It depends. I feel like that's the answer to
I don't want to be,
all
and I
of
hate
life's
being
questions.
that guy. Like, I hate saying depends. I'm all about taking calluses down, okay? So callus is a positive mechanism of the body, right? So what happens is, let's say you start getting a callus on your toe and it gets thin. The problem is, so the whole reason your body's building a callus is trying to protect itself against something. It's creating its natural pad. The problem is, you build a callus, it actually creates more pressure. So you get thicker and thicker and thicker and thicker calluses because of that. So you want to break those down. You don't want them to get too thick. Shaving them down. Now, that's a caveat. I don't want you shaving them down. Don't go get your Swiss Army knife from Boy Scouts or Young Women's or whatever activity you do out there, Girl Scouts. Like, don't go grab your paring knife and cut it down, okay? I would say using a chemical way, so urea, so urea. So you want to look for a lotion with urea in it, 30% or higher, okay? In my office, I had medical grade at 40%, 42%, which is the most you can have in it. And that urea, if you use it daily, actually breaks that callus down. So you still got the protection, but you're not building this crazy amount of callus, right? I would say if they're getting to a bad point, we do medical safe pedicures in my office. I can come in as a physician, trim it down to a comfortable position where you can still do fine. I work with a lot of professional soccer players and their feet. They come in and some of them will be like, cut my calluses off. And some are like, don't touch my calluses. And they're like 4 inches thick. And you're like, how are you even getting that in a shoe? And I'm like, just only take half of it down. Like, it'll be so much better for you. But yeah, because that can actually lead to blistering underneath. And then you get really bad issues. Because that can create a really deep wound or sore on your foot.
Oh. Yeah. So what do you think of like pumice stones? Like
so,
stuff like that?
Yeah. It's really the amount of time you're using it. If you're using it daily, that's not good. Because essentially
like once a week, once every other week.
Yeah, once a week is great. You take your Friday night bath with your glass of wine or Diet Coke for me, whatever it may be. You know, you take your pumice stone, you take it down. Great, right? Okay. The problem is if you use it on a regular basis, you're creating trauma. Your body's going to react to that trauma and actually build more callus. One thing I really like, I have a soap here in my office. It's a hydrating soap, but on the other side has a natural loofah. So I take my heels, I lather it up, I flip it over. It's not very aggressive, and it takes down that callus.
Okay, I think that's really important for trail runners to hear. I think most of us are like really aggressive, like hit it hard kind of people. So don't.
You want to go by that. I always hear of that like cheese grater they use in some of these pedicure places. Like, don't do that. Like, just don't. Treat it pumice stone twice a week. You know, enjoy a tub of ice cream, whatever, take it down, make it a ritual, but don't be too aggressive. That's just the case.
Okay. That makes sense.
Yeah.
Well, Jeff, wow.
Okay, I know that we're limited on time. I just really want to tell Jeff my story of my blisters during my first half. Really fast. So I know you hear stories like this all the time, but it's just very appropriate for this episode. My very first half marathon, I bought a new pair of shoes that were way too big. I didn't realize that they were too big. I heard that you're supposed to go up half a size, a full size. Yeah. Anyways, way too big. And I knew nothing about socks my whole life. My mom took us to Walmart. We bought a pack of socks, and those were our socks for the school year, Yeah, so sure. I had these cotton socks from Walmart, these shoes that were way too big, trained my butt off for this half marathon. I was in the lead for half of the race, and granted, it was a really small local marathon. I was 19 years old. I was excited about it. Okay, I was killing it. I was gonna get
Connor Mance was behind you. You were just like cruising it, Yeah.
I was like I can't make that joke because I just forgot what it's called. The road runner. Tasmanian deal. Anyways.
Oh yeah. The road. Yeah.
I don't know.
Roadrunner. I have no idea.
Roadrunner and Wild Coyote.
The point is, I was going really fast. Okay. And it was a downhill half marathon, and I started to get blisters on the bottom of my feet, like super early on. But I'm like a tough bad A, so I'm like, I'm just gonna push through it. And by the time I got to mile 8. The bottom of both of my feet, it was like one giant blister on the bottom of each foot. Like I was walking on bloody stubs. I couldn't walk anymore, and so I had to pull from the race. And I actually went to New York the following day, got on a flight to New York, and then walked around on bloody stubs in New York for 2 weeks. And the shoes that I wore in New York, I had to throw away because they were literally like drenched in like pus and blood. Like it was disgusting.
Yeah.
Anyway, so that's how I learned my lesson, to find shoes that fit and to get good socks.
Yes. Yes. No, totally. And like, I mean, you can't be a 360 pair pack of Puma socks from Costco. Like, you know, it's so easy. And it's funny because I sell socks in my office for runners, and they're $16 a pair. Some are even more. And like, I think it's hard to wrap your mind around that I'm going to spend that much money for a pair of socks. Is it really that special?
Last forever. If you spend $16 on a pair of socks, I've ran in some socks that I have like on a weekly, every other day basis for years, and they're still fine.
They'll last you forever. Yeah. I mean, and the technology in socks, you would just not know like really how much is really into those socks. And a good pair of socks. Yeah. So like your story, totally. It's that important to spend the money and the time and effort. Maybe that embarrassment initially of going into a store and not knowing anything, potentially throwing some money away by buying the wrong pair of shoes. You know, you gotta taking that time is really important.
Totally. It could cost you your race. It could cost you your goal race.
Cost you a race, cost you a great time in New York.
Exactly.
Cost you, whatever it may be. I mean, the same thing. Like, I see people, it's like they're Disneyland people. They go to Disneyland all the time. And, and they go, my feet hurt. Well, they're wearing junk shoes. They go spend $500 at Disneyland, right? But their feet are hurting because they're wearing their poor shoe gear, Like, it's that you got to put some effort into it. So.
For sure. 100%.
Yeah.
Well, we don't want to keep you all night, Jeff. But
I mean, we do, but we shouldn't.
I could talk all night. I mean, I love talking.
I know this
weird, right?
This has been
awesome.
This has been awesome. It's been enlightening. The way you've explained things, honestly, it's been.
You're really good
amazing.
at what's dumbing
it down.
Just making it simple.
Well, I'm dumb, so I have to dumb it down. Like, if I don't dumb it down, then no one's getting it. So,
anyways,
it's super helpful.
If our listeners want to find you, want to come to your clinic, or just reach out to you with questions, how can they do that? Yeah,
so really great. I think the key thing is because your population, not everyone's in Provo, Utah, where I'm at, right? So I do telehealth visits, where for $50, 15 minutes, we can discuss stuff. You can be anywhere. I can't diagnose outside the state of Utah legally, but I can discuss stuff, give ideas and thoughts. The nice thing about that, if you're like, hey, do I need to come in? That $50 goes towards your appointment, so I don't double charge it if you then do come in. So that's one great way. HammondFootandAnkle.com. Book online. That's great. Call us, text us, phone number 801-377-2274. Make sure I say that right. Honestly, and Instagram, Facebook, send me a message. We're really easy to get in. If you're traveling, we have people come from California. We have people come from Colorado. A lot of the stuff I have here, go look at it. It's very unique to really the Western United States. It's pretty cool.
Awesome. Yeah. And we'll put all of that information in the show notes, including links, so you can go there.
Well, Jeff, this has been awesome. Honestly, an hour spent.
Yeah.
An hour I should have had spent 5 years ago talking.
I know. I'm like, why didn't we know all this 5 years ago?
Anyways, but thank you for taking time to come on the pod.
Thank you. It was awesome. Have a good one. Good luck, everyone out there.
So a big thank you goes out to Dr. Jeffrey Hammond.
That was good. That was really good. And we definitely have to have him back on to talk more about feet. Also, if you're on YouTube, check out this cool sweater I have. It says Silly Goose Lifting Club.
Silly Goose Lifting Club.
Anyways.
All right. Well, anyways, takeaways from Dr. Hammond.
I mean, honestly, it was just a lot of really good information. I really like talking about calluses. That's a question that I've had for years that I've never known. And I feel like a lot of these questions are questions that we all have heard and we all have asked, and we always get different answers. So I think it was really nice to just receive some straightforward answers about these common questions.
Yeah. Yeah. And I'm completely on the same boat with you. Like, I don't know if there was anything like life-changing.
I mean, it's all life-changing. It's all life-changing. It's just, just a lot of really good information that like, you need as a runner.
The way he described how to deal with an Achilles and like how to deal with plantar.
The Achilles stretches are super helpful. Yeah.
Yeah, and the plantar and what causes it, and just to get those down to earth explanations.
Those simplified explanations. Yes. And also the antiperspirant foot spray.
Yeah, I did not know about that.
We gotta find that stuff.
And he talked about like some sort of silicone blister thing that he has. Like, I'm ready to drive down to his place to go see these.
Oh, I know.
I mean, I think it just goes to show, like, you know, like I've gone to some PTs before for things with my body issues that I've had, and I'm not trying to bash PTs or anything.
But like Jeff was saying, you need to find the right doctor. You need to find a doctor that.
These PTs probably weren't very specialized in helping ultra runners.
You need to find one that specializes in running.
Yes, and so
exactly.
Yeah, and so like when he says that he does telecalls for people who are out of state, even like, you know, that he might be able to get you pointed in the right direction and referred to maybe somebody near you. Like, you know, like just that 1 hour that we spent with him, I'm just like, wow, like that. I mean, we were lucky enough that he came on for free, but I would have been happy paying for that to gain that kind of knowledge.
And now he's listening to this.
Yeah.
He's like,
he's like, he should have charged him. Thank you, Jeff. I felt like, you know, if I would have paid for that, I felt like I would have gotten back what I put my money in.
You would have been like, okay, that was worth
that was worth it.
Because maybe you go to a physical therapist, but he specializes in hip replacements.
Yes,
so
knee replacements.
He's not a bad doctor, but he's just not the right doctor for you.
Yes,
you know? So you got to find Jeff Hammond.
Yeah. Anyways,
is the right doctor.
So I now know if I'm having foot and ankle issues, I think Provo's hour 45 from me, but I think I'm probably going to make my way down to Provo. Anyways,
yeah, for sure.
If you can find a good doc, but anyways, thank you, Jeff, for coming on the pod. That was enlightening to just hear about all the different issues we face with our feet here in the ultra world.
And gross.
Yes.
Just kidding. It's not that gross.
You know, I don't think I've ever said my foot is gross. He said everyone says that.
Oh, I have 100% said that about my feet.
Yeah. Have you ever heard me say that?
No.
Yeah. I like my feet.
There you have it.
Yeah.
You know, love your feet, you guys.
You
love
can
your
attest.
Own feet.
I like my feet, don't I?
You do like your feet. Yeah. Yeah. My little sister,
I take my socks off every night and stare at my feet.
This is weird.
It's getting late here in Evanston, Wyoming.
It's weird. My little sister, growing up, said that my big toe looks like SpongeBob's television.
Oh my gosh.
And it made me really self-conscious of my feet for a long time.
I've never thought that once about your big toe.
Well, it's because you never watched SpongeBob.
True.
So to this day, that's what I see when I look at my feet.
Oh, we should have asked Jeff about what he thinks about feet pics and people selling them. I'm just kidding. I'm just kidding.
We should have.
All right. Well, I think it's time to wrap up this podcast.
It's time to go get a snack and go to bed.
Anyways, if you enjoyed this podcast, guys, we'd ask that maybe you share it with someone who might have feet issues or needs to know more about how to take care of their feet. Great podcast if you're preparing for a 100-mile race, because you are bound, whether it be in your training or a race, to come across some sort of issue with your feet. So I definitely think this is an essential one. Great pillar episode from Jeff.
100%.
Last thing before we let you guys go, we just want to invite you to check out our store, trail100.com. We sell our t-shirts there, and we sell running buffs, really nice running buffs from Switchback.
We even have an online course called Run Without Fear, where I teach you how to avoid scary situations when you're running by yourself and what to do if you are in a scary situation, whether it's a person or an animal. Anyways, check it out.
Yes. Check it out. All the proceeds from it go to just right back into the podcast to help build our mission to make the 100-mile distance accessible to all. And remember, if you want to run 100 miles, make it happen.
Feet are cool.
Running 100 miles seems impossible, and maybe even kind of crazy. And it is, but we believe in big crazy dreams. That's why we ran 100 miles. It was such a life-changing experience for us, we decided to devote this podcast to preparing and inspiring you to run your first ultra race.
Are you ready to feel the highest highs and the lowest lows? Are you ready to do what you once thought was impossible? Are you ready for your trail to 100?